Hey folks, my name is Joe McNamara. I'm the marketing director for our risk and response line here at TaskUs, and I am joined with our head of risk and response, Jeff Chugg, who's
Hi.
here to. Hey, how you doing, Jeff?
I'm doing great. Thanks, Joe.
Sounds like you're pretty excited to talk a little bit about healthcare fraud today. For starters, Jeff, we're technically still in a pandemic, although it's been the better part of 18 months, a year and a half. Clearly, a lot of things have changed, especially things that we kind of took for granted as being in person, and where we are today as being able to work remotely, do a lot more things remotely based around communications and connectivity access. But what does that exactly point to when we start looking and breaking down from a health tech or a healthcare perspective?
Yeah, well, I think we are emerging, hopefully, knock on wood, from this 2 years of pandemic life. In a lot of areas of the economy, life has shifted from in person to online. Now that we're shifting back, there are parts that are kind of going back from digital back in person. People want to be back in person. They want to get out and see people and do things. And so, whereas before people would maybe order things online, food or household items, maybe they want to actually go back and set foot in stores to get that kind of social aspect, that living life in person aspect back. One area where they may not be excited to go back in person is to go wait in a doctor's office, to go wait in that waiting room for the doctor who is kind of chronically waiting, like 45 minutes behind, reading those magazines from 1998. I don't think people are really excited about that. And so one area where we may see this shift to digital services really stick is on things like telehealth, online prescription delivery, things like that, where people we've found a way to do it online. We've found a way to maintain the integrity of personal health records. We found a way to kind of connect doctors and patients that works. And I think that may stick a little bit better than other parts of the economy.
As we're looking at some of the trends that we're seeing from where we were at the beginning of the pandemic to now where we are now in a much more telehealth or telemedical place, what types of things are we seeing from the not so good side of the house, the fraud, the just insurance scams, things like that?
We see kind of competing obligations there. So on the one hand, there's the need to comply with regulations like HIPAA, keep confidential certain aspects of patient records. But on the other end, we see this tension of, healthcare fraud is on the rise, payment fraud is on the rise, and so there needs to be this this element of verifying identity that kind of sometimes clashes with this need for privacy. We have seen some stats recently. For example, last year, the U.S. Sentencing Commission reported close to 60,000 cases of medical fraud. And even within those instances of fraud, the average loss attributable to healthcare fraud was about $1 million, which not only is it happening more and more, it's getting more expensive. And so providers, insurers, patients are all having to bear the cost of this fraud. So one thing that technology is giving us, and probably will do so more so in the future, is a way to harmonize the privacy concern along with the anti-fraud concern, to find a way to verify patients, to verify medical information without compromising patient safety.
I would almost assume and would ask your take on this. What exactly are we doing from a vendor or a provider perspective in order to kind of combat the same types of fraud, but at in my opinion, a much higher level scale?
You talking about the medical provider themselves?
Yeah.
Yeah. So, a lot of these online companies, they're platform based, and they contract with, different types of medical providers to provide access to patients, right? And I think anyone who has, done telemedicine has probably experienced what it's like to get onto a portal, request a quick visit to get some antibiotics for the flu, and then have a doctor pop up and be able to talk with them remotely, and be able to get the prescription, go get your antibiotics, right? So that's a pretty common experience nowadays. And one thing that would drive consumer sentiment and reliability is the person that you're talking to a real doctor? And are they a real doctor, licensed in the state they need to be licensed in? And do they have the kind of specialty that they say they have? And are they actually authorized to write prescriptions the way they say they are? And so that responsibility is going to probably fall upon those platform companies to find a way to vet and onboard and manage the verification of these different providers. And I think in the realm of healthcare, there are different layers. There's board certifications. There are hospital memberships at certain hospitals where they practice. Hospital affiliations is what I was thinking of. The board certifications, the languages they speak, their accreditations. Beyond that, it is, are they authorized to write prescriptions, and can we make the right kind of disclosures? For example, there's a regulation that requires certain disclosures for EPCS, the electronic prescription of controlled substances. So if a doctor is writing prescription for a certain medication that falls on that list, well, then they've got to provide identity information on the patient receiving those prescriptions. And so all those things require different layers of verification. So you've got the kind of front, you've got the kind of more intense provider verification for the providers of the platform. You've got the patient verification to make sure that the people buying the services are who they say they are. And so you've got a lot of work going on to verify this for these platform businesses.
And I know one of the biggest things that's on the radar for the latter is really around the discussion of automation, right? And there's always going to be an opportunity to find efficiencies, make things better, but at the same time, what can you tell us about the mix of including more automation into your processes while also making sure that you've got the right kind of checks and balances from a human in the loop perspective?
Absolutely. I mean, I think that automation is going to become more and more of the story on identity verification generally, and certainly healthcare specifically. I think that when you get into that, though, the more complicated the verification, the more you need to have a human in the loop to be involved. And I think about on the provider side, if you are doing things like authenticating hospital memberships, affiliations, then you may actually have to have a human pick up the phone and call a hospital, particularly if it's a hospital without a ton of digitized records, right? Or an easy way to kind of put an API plugin right to their system. You may have to call up medical school to verify the graduation date of that provider. There are a lot of ways in which the automation does not exist today. It's a little bit more complex than what can be provided, or it may just simply be when you've got 50 different states and many different credentialing bodies, it just may be quite a ways off to do that. On the patient side, I think it's a little bit easier to automate some portions of the process, but I think best practice is always going to be to have a mix of automated and human-centered support to verify identity. You typically, even with automation, you're going to have a large pile of false positives or cases in which the algorithm can't make a decision and kind of boots it over to a human. And so that next layer of human review and quality control is going to be essential. So the best way to do this, I think, for health tech companies is to, go in with a strategic partner that is going to kind of take you on an automation journey. A partner that will do some of these manual, labor-intensive verification services off the bat, build your process and policy, and then over time, look for strategic ways to drive automation to streamline and increase the quality of those verification services. That's the best way to do it. As a journey, it's something that's going to take several years to happen. It's not going to happen by signing up for a service off the bat. You're going to get a better outcome with that strategic approach.
one of the things that you mentioned is really around the time it's going to take to really see these changes take place. In the same sense, based on what you're seeing from a trends perspective, what are we going to see in the next 5 or maybe 10 years out in this space?
One of the questions I had that's related to that, in looking at this topic is, well, do doctors like this trend? Are they going to push for it, or are they going to push against it? Right? Studies show is that doctors are actually in favor largely of this, digital transformation. They feel more connected to patients, and they believe that over the next 10 years, these technologies are going to drive advances and become more of the story in healthcare services. So, this particular study, 84% of clinicians in Asia, 77% in South America, even 52% in North America, all believe that, digital health, number one, is positive, and number two is going to be increasing over the next 10 years. There's something there in the fact that maybe in developing countries where the number of doctors, especially specialized doctors, available in certain populations may be more limited. Digital health services, increases access to that medical care. It may drive, patient outcomes in a very positive way, because those people maybe would have not had access to those at all. And so I think overall, certainly in the developing world, but also in Europe and the US, I think it's going to, still seen favorably. It's still in the upward swing, and I think it's something that we'll continue to see grow over the coming years.
All right, so let's land this thing. Any final thoughts or anything else that you want to kind of convey to our audience, again, in this inaugural episode of what I'm sure will be the first of many, where we get a chance to sit down as a risk and response team and essentially tackle some of the more current events or trends that we're seeing across verticals that we're involved in?
Yeah, I think, one takeaway is, this shift to digital medical services is still a new phenomenon. And so in what ways are the regulators going to, change things? In what ways are we going to see threats from bad actors? It's kind of a big unknown right now. I think those things are going to come. What form they're going to take, I don't know. But one thing that these health tech companies can do now to prepare for those uncertainties is find a strategic partner who's going to help put together a way to perform identity verification services on both the provider side and the patient side, and begin that journey of onboarding that partner, looking for strategic ways to implement automation, so that when the day comes when the regulators crack down or there's some new flavor of fraud that attacks the healthcare system, they're prepared for that. And now's the time to kind of get things set up before it hits.